Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss acute distress respiratory syndrome caused due to severe hypoxemia in the absence of a cardiogenic cause. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, what is cardiogenic shock?
Cardiogenic shock, also known as cardiac shock, happens when your heart cannot pump enough blood and oxygen to the brain and other vital organs. This is a life-threatening emergency. It is treatable if diagnosed right away, so it's important to know the warning signs. It occurs when there is inflammatory damage to the alveoli, which leads to pulmonary edema, respiratory compromise, and ultimately acute respiratory failure.
What are the causes of ADRS?
The causes of ARDS can be divided into direct and indirect. The mechanical cause of ARDS is fluid leak from the smallest blood vessels in the lungs into the tiny air sacs where blood is oxygenated. Normally, a protective membrane keeps the fluid in the vessels. Severe illness or injury, however, can cause damage to the membrane, leading to the fluid leakages of ARDS. Direct is because of pneumonia, smoke inhalation, aspiration, fat embolus. Indirect is because of sepsis, acute pancreatitis, polytrauma, and major burns.
What are the risk factors?
Most people who develop ARDS are already hospitalized for other condition and many are critically ill. You're especially at risk if you have a widespread infection in your bloodstream, that is sepsis. People who have a history of chronic alcoholism are at higher risk of developing ARDS. They are also more likely to die of ARDS.
What are the complications of ADRS?
If you have ARDS, you can develop other medical problems while in the hospital. The most common problems are blood clot. Lying still in the hospital while you're on a ventilator can increase your risk of developing blood clots, particularly in the deep veins in your body. If a clot forms in your leg, a portion of it can break off and travel to one or both of your lungs, that is, causing pulmonary embolism, where it blocks blood flow. Collapsed lung, that's pneumothorax. In most ARDS cases, a breathing machine called a ventilator is used to increase oxygen in the body and force fluid out of the lungs. However, the pressure and air volume of the ventilator can force gas to go through a small hole in the very outside of the lung and cause the lung to collapse. Infections. Because the ventilator is attached directly to a tube inserted in your windpipe, this makes it much easier for germs to infect and further injure your lungs. Scarring, pulmonary fibrosis. Scarring and thickening of the tissue between the air sac can occur within a few weeks of the onset of ARDS. This stiffens your lungs, making it even more difficult for oxygen to flow from the air sac into your bloodstream.
How is ADRS diagnosed?
The diagnosis is based on the physical exam, chest x-ray, and oxygen levels. Chest x-ray can reveal which parts of your lungs and how much of the lungs have fluid in them and whether your heart is enlarged. Computerized tomography, that's a CT scan, combines X-ray images taken from many different directions into cross-sectional views of internal organs. CT scans can provide detailed information about the structures within the heart and lungs. A lab test using blood from an artery in your wrist can measure your oxygen level. Other types of blood tests can check for signs of infection or anemia. If your doctor suspects that you have a lung infection, secretions from your airway may be tested to determine the cause of the infection. Because the signs and symptoms of ARDS are similar to those of certain heart problems, your doctor may recommend heart tests such as electrocardiogram. This painless test tracks the electrical activity in your heart. It involves attaching several wired sensors to your body. The other, echocardiogram, a sonogram of the heart. This test can reveal problems with the structures and the functions of your heart.
How is ADRS treated?
The first goal in treating ARDS is to improve the level of oxygen in your blood. Without oxygen, your organs can't function properly. To get more oxygen into your bloodstream, your doctor will likely use supplemental oxygen. For milder symptoms or as a temporary measure, oxygen may be delivered through a mask that fits tightly over your nose and mouth. Mechanical ventilation. Most people with ARDS will need the help of a machine to breathe. A mechanical ventilator pushes air into your lungs and forces some of the fluid out of the air sacs. Carefully managing the number of intravenous fluids is crucial. Too much fluid can increase fluid buildup in the lungs. Too little fluid can put a strain on your heart and other organs and lead to shock. People with ARDS usually are given medications to prevent and treat infection, relieve pain and discomfort, prevent blood clots in the legs and lungs, minimize gastric reflex, and sedate.
So, doctor, what message would you like to give to our listeners?
Recovery from ARDS can be a long road and you'll need plenty of support. Although everyone's recovery is different, being aware of common challenges encountered by others with the disorder can help. Seek professional help where needed.
Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this informative talk has enlightened our listeners about ADRS.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.